Name the top 3 reasons why the United States healthcare system needs work.
I believe the United States healthcare system needs work because of the inflation and the drug prices. Because if you go to Mexico, you can get a $5 or pay $5 for a drug, but in America it'd be $50.
So are you saying that's like the most important reason? Is the high drug cost?
No, but it's an important factor.
Because the high drug cost makes it unaffordable for like the average family, right?
Yeah.
I think what needs to be fixed is like how like operations like nowadays are like super inflated prices. Like I read in the article like what was MRI? The MRI was created like in the 80s or the 90s, and so like it was new back then. So like maybe it was expensive back then, but they shouldn't have risen the price since then. It's like in Japan, what used to be like $1,000 procedure is now like a $30 procedure. It's like it's $1,000 here in the U.S., but $30 in Japan. And that's not fair.
Okay, the thing that I think that needs help would be the insurance companies and the doctors. They're denying people of treatment that they need because they don't fit the requirements.
So we have inflated prices, health insurance companies, that'd be the second one. Like, so what are you saying? It should be like universal?
Yeah.
Like a new healthcare system?
Like a flat rate for everyone. So like everyone has the same coverage, but if you wanted more coverage, you can upgrade and buy it yourself.
America is the only wealthy and industrialized country that does not offer universal health care for its citizens. So I think we should think about switching. And obviously, you could say that our healthcare doesn't work if we're ranked like 38th in the world and we're 47th in infant mortality.
Yeah. So like some stories about what we heard, but like on a first-hand account, like I've got an MRI before, and like the copay are like it's like super expensive, and like my brother broke his hand when he was younger, and like just recently went and got an MRI on his shoulder, but like Cloud paid for that, so like that helped. So they paid for all of it, but it would have been so expensive. It's like it's just such an inflated price.
And I think that the third problem is just like we spend way too much on healthcare. Like the United States spends $8,250 per capita on healthcare, which is 22% higher than the next worst country. Yeah. So we're not just bad, we're like worse than bad. Yeah. And since 1960, the per capita cost of healthcare would have been $147 adjusted for today's inflation. But today, today it's $1,082. So
More than that much.
It has grown 660% since 1960.
And Connor, did you say like how they're denying like minorities like care that you said, or?
Yeah, they're denying like people that just don't fit the requirements.
And I feel like that kind of goes along with like how like rural and minority like communities like they get less like coverage. So, like inner cities and like people in the country, they have less a chance of get good like health care overall.
Yeah. And then like another thing was like when we watched the documentary Sicko, and like how the lady said she couldn't get treatment because like she had a yeast infection in the past or something like that. And I was like, they denied her treatment because of a past medical condition.
I think that like going on, the problem is we treat healthcare as a business.
Yeah.
It's not a business. It's a right. It should be taken over by the government because the government could lower the drug prices. It's not. It shouldn't be treated as a business because that's not what it is. You can't play with people's lives.
Yeah.
We always say you can't put a price on life, right?
Mm-hmm.
That's what they're doing, and it's just stupid that like a doctor can take the oath to, like, save life at all costs, but if they don't have money, they don't save them. So
yeah.
It's just stupid that we do that.
Or like some doctors, like when we watched I watched the uninsured videos, like the trailer. Like some doctors will they'll operate on you, but like you'll go into such like thousands of dollars of debt. Like it takes away all your like savings.
Yes.
It'll take away money from your kids when it rolls over.
Yeah.
It rolls over.
Yeah. They're gonna have to pay for it.
Yeah.
Somehow, some way, someone's gonna pay for it.
Where does it talk about that we pay like $1,900 for other people's?
Yeah. So like people who can't pay for it.
Another statistic is that in the United States, 30% of our total amount of money spent on healthcare is wasted. So we're just wasting a ton of money, which is healthcare is our biggest expenditure
Expenditure.
on our GDP. What is it? We spend.
And when we watched, while you're looking that up, when we watched like the movie Sicko, wait, was Sicko's the one?
Sicko's the one we watched in class.
So like
First one.
they went over to like Great Britain, and like they went and like interviewed like in the hospital, and everyone seemed so happy. Like no one had to pay for anything. Like everything was already paid for. They looked so much happier. Like just in general, everyone there looked happier. Even the people in the drugstore, they looked happier. Everyone just kind of looked happier with life because they don't have to worry about silly things like that.
Yeah, they kind of laughed at us when there was like, yeah, you guys have to
Yeah,
pay
like-
for all that. Like,
Like
you
that's
have to.
that's our right to have like health care.
Yeah, and another thing is we spend almost 20% of our total GDP on healthcare, which is about $1 in $5. So we just like, it's such a waste because we spend so much more than everybody else, and like right now the total amount is 2.6 trillion per year, but by 2021 it's expected to be 4.8 trillion, which
What-
is extremely
That's
high.
crazy. What I think is ridiculous is how we claim to be one of the best like healthcare systems in the world, and yet like a country like Cuba, like no offense to Cuba, but they've been like they, I don't know how to say it, like they haven't been like with the world in like
Yes.
years. Like don't get me wrong, there's smart people there, but like I feel like
Yeah.
like we should
We
have
should-
a better infant.
Yeah.
Like
With what we've been able, like
yeah, we should have a smaller infant mortality rate than them.
It's like safe to say that we're like the most.
Yeah,
we're the richest country in the world, like most power. We've
one of
been
the most
powerful.
technologically advanced.
We should
like
have no excuse
like
to not
South
have the
Korea,
best
et cetera.
healthcare system.
What else is there? We talk about why Americans don't have health care.
It goes back to like unaffordable.
Yeah.
So like that's why I just going back to I feel like we should have a base coverage for everyone,
Somehow.
because like I don't understand how someone who lives in a country that's supposed to be so prosperous can't afford to have health care coverage. Like I feel like that's a basic right for everyone.
So the three reasons, putting them in the top three, what would you say the most important is?
I feel like we need to regulate
So like a
all
universal
medical
healthcare,
costs.
we should
Yeah.
Yes, everyone
reform
should.
it.
Yeah.
So that should be the top three. We need to change it to a universal somehow, some way, or somehow to make it cover everybody.
Yeah, it should cover everyone.
Um,
That's the number one in my mind.
The next two biggest problems would be it needs work because of like the high cost of drugs. Like
Yeah. I think high cost of drugs and high cost of procedures are about the same thing. Like they're
Yeah.
both
Yeah.
just so inflated.
And I'd say the third cost is that people are dying because of it. Like the third reason it needs like reforming is because people are dying because they don't get the care they need, like prematurely.
Was it
It's about-
20,000?
Do you think this goes back
No,
to like
it's-
Americans
I'm
being
pretty sure it was
greedy? Like
20,000.
No, it says a
Yeah.
recent
It would
study.
just be because the insurance companies
because we
not wanting to
like
spend
what
their
Cody
money.
said earlier, like
Hold on.
you don't play with people's lives. Like
Yeah.
like we're turning it into a business when it's not really a business. Like you're just
And right here it says a recent study found that a lack of insurance coverage can be tied to 45,000 deaths per year in the United States, and that people without health insurance have a 40% higher chance of death. So obviously, 45,000 people are dying as a result of our horrible.
like obviously like the statistics should be showing our government that something's not working. Like we need to change stuff up.
Yeah. Obviously, it needs to change. People can argue that.
Because what'd you say? Like we're 26th in the world in like
Yeah.
healthcare.
And people who say that it would cost too much, well, we already spend the most in the world. Obviously, that's not working. That we spend the most in the world. So
Like there's obviously a waste somewhere.
Yeah.
Like we're not doing something right.
why spend that much money if it's not going to work? I mean,
Right here it says that almost 2 million people each year file bankruptcy because they can't pay for their medical bills.
And when I was reading about like brain cancer back in the previous unit, it said that like I don't know what the statistic was, like 20,000 a day or is it 20,000 a year will be diagnosed with like a certain type of brain cancer. Like that's an expensive like procedure. Like how many of those 20,000 can honestly afford to have that procedure done?
Yeah.
Like not like file bankruptcy, a very small amount. And like you can't do anything about the like the sicknesses you get or like what happens to you. So like I don't feel like that should almost be put on you. Like, it's a burden on you. It's already a burden to begin with. So then why does the government put a burden of money on you too?
Like America's a country on like it's supposed to be built on equality and like those kind of values, but our health system is built on whoever has money.
Yeah.
Like if you have money, you can live. If you don't, it's not equal. Everybody should be able to live. It should be universal.
Well, I think that's it.